Welcome back, future coding experts. So today we are diving straight into part 34 of our CPC exam series. We're tackling the urinary and male genital systems. Now, trust me on this. There are some massive bundling traps hiding in these CPT codes, and you absolutely need to know them. Before we crack the code, make sure to like, share, and subscribe to Decode Healthcare with Harshal so you never miss an explainer on this journey. Okay, here's our exam roadmap for today. Number 1. An overview of this system. 2. Renal and ureteral procedures. 3. Cystoscopy rules. 4. Prostate procedures. And finally, number 5, we're going to wrap up with a quick visual cheat sheet. Let's get right into it. Section 1. Urinary and male genital overview. CPT codes 5010 through 5589. Now, what's really interesting here is just the sheer anatomical territory we're covering. I mean, think of it as literally tracking the flow. So for the urinary system, you track it from the kidneys, down the ureters, into the bladder, and then right out the urethra. And for the male genital system, we're looking at the testes, penis, and prostate. Actually, following this anatomical flow, it's a fantastic memory hook. Because if you know exactly where you are in the flow, you're way less likely to accidentally pull a code from the wrong family. Moving on to Section 2, Renal and Ureteral Procedures. Okay, so when you're coding nephrectomies, the surgical removal of a kidney, what is the very first thing you need to look for in that operative note? It's the approach. Was it open or was it laparoscopic? I'm telling you, pulling an open code for a laparoscopic procedure will instantly cost you points on the exam. The second thing, look at the extent. Did the surgeon do a partial, a total, or radical removal? Because a partial open nephrectomy, something like code 5240, is a completely different ballgame from a laparoscopic radical nephrectomy. Now, when it comes to kidney stones or renal calculi, you have to code the specific intervention they used. Is it ESWL, where they use external sound waves to literally crush the stone from the outside? Or maybe it's a percutaneous approach, going directly through the skin. Or, perhaps it's an endoscopic ureteroscopy. It should just fragment and grab the stone. The surgical method dictates your code every single time. So let me let you in on a crucial secret regarding ureteral stenting. A lot of times, during a ureteroscopy, the surgeon will place a temporary or indwelling double J stent just to keep the ureter open. You absolutely must check the code descriptor, like code 52356 for instance, to see if that stent placement is already bundled into the lithotripsy procedure. Spoiler alert, it very often is. Section 3, Cystourethropy rules and TUBT. Right, so this is where the NCCI edits really come out to play on your exam. Listen closely because this is a huge trap. Diagnostic cystoscopy, code 52000, is always bundled into any surgical cystourethropy performed during that same session. So if the surgeon goes in with a scope just to take a look around and then says, hey, let's do a biopsy or take out a tumor while we're here, you only code the surgical procedure. You literally never bill the diagnostic scope separately. And this brings us to how we code for TURPs, transurethral resection of a bladder tumor. It's actually pretty straightforward because your code selection is driven strictly by these specific size brackets. Got a small lesion under 0.5 centimeter? That maps to 52224. Medium lesions up to 2.0 centimeters? That's 52235. And those large lesions over 2.0 centimeters maps straight to 52240. You just have to do the math, check the operative note, and pick the right bracket. All right, Section 4, Prostate Procedures and Guidelines. The gold standard procedure here is the TURP, CPT code 52601. Now, the exam is absolutely going to try to trick you here. They'll give you a super detailed note about the surgeon using electrocautery or their heroic efforts to control postoperative bleeding, making it sound like extra, billable work. Do not fall for it. All of those actions are inherently bundled right into the complete TURP code. Also, keep an eagle eye on whether this is an initial procedure or treatment for a recurrent issue, because that changes your coding path entirely. For prostate biopsies, code 55700 represents the transrectal needle or punch biopsy. But the big question you need to ask is about imaging. The core rule here is that guidance is only separately reported when it isn't already included in the parent code. Always, always check if the transrectal ultrasound, the TRUS, needs to be billed separately, or if you're dealing with a combination code that already bundles the imaging. Radical prostatectomies follow the exact same rule as nephrectomies. The surgical approach is everything. Are we talking an open retropubic approach, a perineal approach, or is it laparoscopic and robotic assisted? This is a highly tested, really modern update to the CPT manual. For instance, check out CPT code 55866. It specifically describes a laparoscopic retropubic radical prostatectomy that includes robotic assistance. So read that operative note carefully. Section 5, Part 34 Visual Cheat Sheet. Okay, we've covered a ton of ground today, and honestly, congratulations on getting through this dense material. Let's bring it all together into a high-yield study guide that you can screenshot for your prep. Here's your cheat sheet. Remember these 3 things. Number 1, a diagnostic cystoscopy is always bundled into a surgical one, no exceptions. Number 2, turbit codes are selected strictly based on the size of the bladder tumor, small, medium, or large. And number 3, code 52601 for a TURP completely bundles in electric artery and the control of post-op bleeding. Seriously, burn these rules into your memory. So, you are one step closer to CPC exam success. But the journey definitely continues. In Part 35, we're going to be shifting gears to the female genital system and maternity care. We'll be decoding the complexities of hysterectomies and those massive, highly tested global OB package rolls. But before we wrap up, I want you to ask yourself, how much revenue is lost every single day just because coders misunderstand what is truly bundled into a surgical package? Master these edits, and you become invaluable. Keep studying hard, and I'll see you in the next explainer.